Good morning and good afternoon, everybody. Welcome to this webinar. I'm glad that you come to attend. We are going to talk about how to put data in the driver's seat. So how can we unlocking data for decision making with the PEPFAR Management Dashboard. Next. This webinar, we are going to have three pieces. First of all, my name is Lourdes de la Pieza. I'm Principal Technical Advisor for Leadership Management Project. And I will be the one in charge to do an introduction about the dashboard. Then I will pass the micro to Danilo Rayo, who is Director for DRB Consulting and Translations. And he will give us the background and features of the dashboard. And then we are going to have three experiences. How is the dashboard put in action through the pilot? First of all, we are going to have Dr. Doreen Agasha, Senior Management Monitor and Evaluation Officer from Protecting Families Against HIV/AIDS, PREFA. Then we are going to have Peter Nujunja, Acting Monitor and Evaluation Manager from National Organization of Peer Educators, NOPE. And finally, we are going to have Peter Muganga, Head of Internal Audit from Reproductive Health Uganda. So let's start. Next. We have LMG as a project. We will be observing the need of many NGOs and how managers are overwhelmed with data and how it is difficult to identify what are the strategic indicators they have to focus on. So it is critical to select key indicators that in a snapshot can reveal how is the program status and trends, so they can do a systematic analysis and systemic analysis of the conditions between programmatic, financial, and management indicators, so they can make good decisions to improve the performance of their programs. Next. So the PEPFAR Management Dashboard, what is our approach? So LMG, our project, seeks to develop tools and operational process to empower local implementing partners to manage their operations more effectively. At the end, the purpose is how they can improve the performance and the results. So the dashboard provides managers with an easy way to read in real time how are the status of their program. So the dashboard provides a dynamic graphical presentation of the current status and historical trends of the key performance indicators, enabling them to make on-time decision making. Next. So we have a LMG project through MSH, had a previous experience working with country coordination mechanism and principal recipients from Global Fund and developing dashboards. So based on that experience, we decided to develop a dashboard for NGOs working in PEPFAR projects. But in fact, this dashboard can be implemented for any NGO for different programs. So in the first phase, from May to September 2012, we worked with two CSOs in Uganda, with RSU and PREFA. So we work with them selecting their indicators and applying all these indicators to the specific dashboard. But then we say that it was needed to try with another two organizations, but also to make the dashboard generic, so it can be applied for other programs, not necessarily these very specific programs that RSU and PREFA had. So from January to September 2014, we work with two CSOs in Kenya, with NOPE and Kanko. Next. Now I would like to pass the baton to Danilo Rayo, who will lead us to how the dashboard is organized and how it functions.
Thank you, Lourdes. Danilo Rayo speaking to you out of Nicaragua. Thank you for joining us in this webinar. The first most important question, what is a management dashboard? It's important to say that it is a user-friendly tool that makes use of critical indicators that enables managers to take a quick look at the most important data and situations within their organization. The key point here is that the user-friendliness of the dashboard, and that it's not only an informational tool, but also a part of a management improvement process. So the dashboard is not a database, and it doesn't replace the current existing reporting systems of the organization. And an important fact is that it combines the use of Excel and SAP. But a very important feature of it is that it extensively uses Excel, which is widely available in many organizations today. Next, please. When and how can we use it? Well, we can use it for different audiences in a variety of settings for different organizations, but we can also use it in different formats. And that's a part of the beauty of the dashboard, that when you share it, you try to overcome the traditional limitations of key information sharing. When you use it with different audiences, you can use it to present it to executive directors or other middle management implementation staff in a variety of settings, such as project team meetings or board meetings, depending on the depth of information that you wish to present. Also for organizations that handle an individual project or larger organizations that handle multiple projects. And as I was mentioning, in a variety of formats, ranging from Microsoft Word, as an email attachment, as a dynamic PDF file, which is the most common use of it for sharing, and as a PowerPoint slide, which becomes very handy when you're doing executive presentations. Next. There are four main components of dashboard. Dashboard has a program component, a finance component, a management component, and a very, very important and key component, which is an action plan. And that we're going to discuss the main features of each of these components later on. Next, please. The program component tracks the results of the implementation of activities. So it allows us to see what are the results of the investments being made by the organization. Now, the finance component, on the other hand, it provides us an idea of the flow of money when it comes from a particular donor, it reaches the organization, how that money is spent, and we use specific indicators for that, or how that money is later dispersed to other minor interventions within the organization. The management component allows us to see what if the critical strategical areas or the key delivery mechanisms are in place. Because if these mechanisms were not in place, they could impede proper implementation of programs interventions. And finally, as I was mentioning, the action plan, which allows us to pinpoint the areas that are the result of an intensive data analysis, but also areas that identify gaps that need to be filled and on which decisions needs to be made. Next, please. The dashboard generation process, as I was mentioning, is aside from being a technological exercise to some extent, it's also a management improvement process. Why? Because it allows an organization to establish standardized protocols for producing and analyzing data and then using it for decision making. So it starts with a conceptualization phase. Then it moves to a setup and installation phase, which is more related to information technology. Then a more management and administration-oriented phase, which is using and managing the management dashboard. And finally, at the end of the year, archiving it and setting up the dashboard for the following year. Next, please. The conceptualization phase tries to ensure that the organization has the requirements, the basic requirements from a technological standpoint, meaning the appropriate hardware and software, and from an organizational standpoint, looking at the basic reporting systems within the organization. It also allows the organizations to identify the monitoring levels that they wish to analyze the data on, based on which they want to analyze their data. For example, analyzing it by project, by donor, by indicator, or by a combination of the above. And also, this conceptualization stage allows the organization to define performance thresholds, which are these limits that provide like the borderlines on which to base good or less than appropriate implementation. For this, there are several tools developed and which are available at the PEPFAR website that organizations can use to comply with each of these stages. Next. The second phase that we mentioned was the actual installation of the dashboard files. As I was mentioning, the beauty of this dashboard is the extensive use of Excel. And most of this processing and gathering of requirements and information, as well as general setup data, is done in an Excel file called the data master file, which we're going to discuss a little bit more in detail in a few minutes. But the dashboard also makes use of the SAP software, which is produced by a German company. And regularly within our organization, a person is, or a set of persons are identified as dashboard champions, which are the ones in charge of not only checking the quality of data that's going to be put into the dashboard, also actually generating it. We're going to discuss that in detail in a little bit. Next. In the case of the Excel file, that's called the dashboard master file, it has two basic parts. The first part is a setup tab, which contains the basic information for identifying the data that's being put into the dashboard. And the second part of this file is the dashboard master file actual data, which is the actual data that's produced quarterly for each of the components of the dashboard analyzed: the programmatic component, the finance component, the management component, and a fourth one, which is a reporting component, prior to actually using that information to generate an action plan. Next. The first part of the dashboard master file, as I was saying, is the setup tab. And as you can see here, there are a number of fields where users fill out basic information of the dashboard, such as the dashboard name, the dashboard start date, which is very important because the dashboard start date determines the arrangement of the quarters that are shown in the right section of this panel. Also, to keep track of who makes changes and when these changes are made, there are specific fields for the date of when the dashboard was last changed and who it was changed by. Following this information, there's some fields for entering the level or the monitoring levels that the organization has chosen in order to analyze and generate their dashboard. In the case of this example, the first level is by indicator, the second by donor, then by project, and then by population field. Obviously, depending on the organizations, you could have multiple donors contributing funds that are going to impact a specific indicator, or you could have multiple donors and multiple projects using different indicators. All these combinations are taken care of in the other sections of the dashboard. Finally, the programmatic reporting field defines the level at which reports are going to be analyzed and produced for the dashboard. Then we move on to this the finance hierarchy, which is also linked to the programmatic hierarchy because it makes use of basically the same levels, but it only allows us to input two levels. In this case, it's level 1 is donor, and then level 2 is project. It is important to mention that indicators that are linked to finance are already given and are standard, and we're going to see them in a little bit. The financial reporting field needs to match the programmatic reporting field described above, so that the information that is produced at the end in the dashboard is consistent. Next, please. This setup tab also contains a section that allows the users to define the thresholds so that they can determine what is an adequate performance, what is less than adequate performance, and to see areas where there are particular problems. So in the case of the programmatic thresholds, you see there are 3 colors, such as a traffic light arrangement. So what the numbers that I put in there are the upper limits of the threshold. So anything below 60 will be red. Anything above 60 and below 80 inclusively will be yellow. And then anything above 100 will also be green, and anything above 80 and 100 will also be green. In the case of the financial thresholds, since these indicators are already given, the user has here the liberty to define their own thresholds, and you not only have the ability to define the red colors for the less than adequate performance linked to low values of an indicator, but you can also define the thresholds that are going to provide a less than adequate performance above 100%. In this case, for funds received versus budget, expenditures versus funds received, and finally, expenses versus the actual budgets. The finalize setup and create data file buttons are used once all the information are entered. Next, please. The other section of this data master file is a set of lists. When, depending on the reporting levels that the user defined, the user can put in the actual number of the name of the indicators, the actual name of donors, projects, population groups, and also it has spaces for defining management indicators, which are linked to those areas that we talked about that, if they are not present, would impede the proper implementation of activities. As you can see, the finance indicators are already given and cannot be changed. There is a space here for putting in up to 30 pieces of data. Next, please. The other tab of the data master file is the spaces where you actually put in the quarterly data. So every section, be it for program, finance, management, has a basic set of arrangements that are very similar. For example, it's focused on actually defining the targets and quarter by quarter putting in or filling in the actual values that have been obtained for a particular indicator. In this example, for example, for program indicators, number of people counseled for text workers has all the target data filled in and the actual data filled in, which obviously provides the ability to generate an indicator for performance. This is basically the same arrangements for the other tabs. Next, please. Next slide, please. There is a reporting indicators tab, and here, as you can see, those numbers that are put in there are basically used to see the reports that are planned and those reports that were received appropriately and on time. This is a very important part of the dashboard because it allows you to actually put in the data quarter by quarter. There's another section, which is the target section, which needs to be pre-filled. Now we move on to the actual action plan. This is a strategic piece of the dashboard. Why? Because it summarizes the results of all the analysis that it's done with the actual data. So it allows the user to define for every program area up to 20 actions that are linked to data that was presented in the dashboard. This is it is important that this action plan be filled in after dashboard data has been generated and analyzed. So, for example, this is showing the programmatic area. It not only provides a space for the actual actions, but also a deadline information when this needs to be done by, and a responsible person, and also comments and status. One or green for complete, in progress is 0, and incomplete is -1, and this will show differently as we will see in the actual dashboard. This, as I mentioned, is a very strategic and important part of the dashboard, because this is what will allow management and other people involved in the organization to actually identify gaps, and to have a particular record of how these gaps are being closed over time. Next, please. The dashboard generation process from a technological perspective is a 4-step process. As you saw, there is quite a bit of information to be put in the dashboard master file. Prior to this, there are other Excel formats that were shown initially, such as the dashboard reporting matrix and the indicator selection sheet, which will fit directly into the dashboard master file. Once all information is filled in, the user can then generate what's called the dashboard data file, which is a dashboard that will allow the SAP software to display the visual information. Then this data file is imported in the SAP dashboard generation software and exported to the preferred format of your choice. As I mentioned, be it in Word to embed it into the document, be it in Outlook to put it as an email attachment, be it in Adobe PDF dynamic file, which we're going to see an example of, or as a PowerPoint slide. Next, please. Then the next slide, please. Oh, okay. So for this particular section of the webinar, I want to share what an actual dashboard looks like. If I could please get a presenter privilege. Thank you. So I'm going to share a dashboard for a place called Fictitia, so that you can see the basic functionality in the basic sections. Okay, hopefully you can all see my screen. So this is what the basic dashboard looks like. On top, it has basic information that, as you saw, was put in the dashboard master file. It has the 4 tabs linked to the 4 components that I spoke about. It can be customized using the SAP software to have the organizational logo and other organizational information here. And below each tab, there are drop-down lists to select indicators, but also the levels of reporting. For example, if I click here, I will see the number of available indicators that I set up for this Fictitia dashboard. Let's see if we select, for example, the number of individuals reached through HIV activities. Then this drop-down list allows me to select the donor that is contributed to a particular indicator, and the actual project that this indicator is linked to. And as I have defined it, the number of, or the population group that is linked to this indicator. When you do the selection, you may have noticed that the bars in this graph change, and that this this is like a speed or performance meter is showing the actual data. The same would change if we selected another indicator, or if we selected another donor, and or another population group. bars will change for that particular selection. If you click on each of these bars, it will show you the actual values. But this value here, shown on this meter, will show you the indicator calculated based on this total. Right here, for example, as you can see, the performance for this particular indicator is shown as yellow. Why? Because I have defined my thresholds, my programmatic thresholds, to be anything above 60 and below 80. If something was above 80, it would show in the green. Or if anything was below 60, the actual performance, then it will show in the red area. Down below, if I had filled in particular comments for this indicator, for example, saying that a typical situation that a particular target was probably overestimated or underestimated, then these comments could appear here. This area for programmatic reporting, as you remember, allows you to select by each quarter the effectiveness or the adequacy of a presentation and the quality of reports for the programmatic area. Right here, you see that there's probably 3 reports were expected to be, received by a particular date, and only 2 were received on time. So it's showing the red. This performance, on the other hand, is saying that reports were 100% of the reports were received as complete. The important thing in analyzing the dashboard data is that these are not islands; these are program components. You have to see them from an integral or comprehensive perspective. So, for example, you could answer questions such as, what if we have spent only 20% of our budget in a particular quarter, but we have already attained 90% of our programmatic goals? So what is happening? Are we that efficient, or simply we are not having financial reporting on time? These type of questions are the ones that are going to be very, very important for the action plan. If we move to the next section with the financial indicators, you'll see the same kind of behavior. You can select the actual donor, the project, and then data will show particularly for that selection for these already given indicators. So it's showing all the flow, as I mentioned, from the point that the funds are received from the donor, how that money is spent versus the budget, and how that money is spent versus the funds that were received, or any onward disbursements that were made to other, let's say, sub-recipients of the information. Also, I wanted to show you the actual action plan screen. For each of the areas that are, or the comments that are made, are fed into this action plan screen. So here, for example, in the for this particular programmatic area, there was a comment linked to data quality check. There was only a test comment, but the status was showing as in progress. Other comments that were generated after analyzing the dashboard data were showing that there was this task was already completed. For example, financial management procedures to be audited for all implemented agents with reference to other organizations. By looking at this, you can see that this task or action has already been completed. But this provides the roadmap for the managers and for other implementers to see where they are at regarding the gaps that were identified. Okay, I'm going to stop this demonstration here to go back to the actual presentation and the final part. The fourth phase in this generation process is once this data has been analyzed and an action plan has been produced for a particular quarter and it's already assigned to a particular person to implement it by a certain date. Then it's time to conduct other processes such as archiving the management dashboard, producing, for example, a folder structure that will allow you to keep track of all the dashboards generated over time. This obviously would need to be formalized, all these procedures. And a very important task is actually setting up any year's management dashboard, which obviously would require defining other general information, again, such as the start date, which would be, for example, January of the following year. So the quarter information are rearranged, and the whole process starts all over again. Next, please. There are important principles linked to the PEPFAR Management Dashboard. The first is that management should ensure the presence of basic requirements that are necessary to set up the dashboard. For example, they may have all the information technology requirements, but what if we don't have set up procedures for reporting or indicator production? So it wouldn't be as practical, to actually implement the dashboard until we have all those systems in place. Also, a very important principle is that the IT principle of garbage in, garbage out applies to the concept of the dashboard. If you have, it's like having a Rolls Royce and you're not putting in gas but only water, so you're not getting anywhere, even though you have the best machine in the world. So the same concept applies to the dashboard. Also, that the use of the dashboard is probably a means to an end, and as I said, a part of a management improvement process. Its mere implementation does not guarantee improvement in performance, but it's how it's used strategically to analyze information and to share it with specific audiences. There's where the actual and most important value of the dashboard remains. Also, that the dashboard requires management to openly acknowledge good as well as poor performance. Sometimes we are not as eager to recognize our errors or wrongdoings, or the fact that we're not actually doing something right, that we need to do it better. So we need to have the sufficient humbleness to recognize this for improvement, obviously. Also, the organization should establish a dashboard project team. As I said, the dashboard is only as good as the team that uses it as well. So people who have the sufficient time to dedicate it and the sufficient drive to actually think that this can be a useful and strategic tool for their organizations. Also, that obviously the right people need to be identified for the role of dashboard champions. These people would need to have a specific set of skills from a technological perspective, but also from the data analysis and synthesis perspective. And also that this is a whole consultative process. So the dashboard project team should always consult with users of the dashboard, because sometimes you can produce a lot of information, but if that information is not precisely what the user needs, then it's obviously useless to them, unless you are producing specific indicators that are informed by users' needs. And in this case, users can be board directors, members of specific strategic teams, or other audiences like partners and donors. Okay, so in a nutshell, that's an overall view of what the dashboard is, how it is generated, how it can be used, and why it is important to have it as part of your organizational toolkit. Thanks very much.
Thank you so much, Danilo, for your presentation. Before going into sharing some field experience, I would like everybody, if you have any questions, please start writing your questions. We will answer all the questions at the end of the presentation. And now I'm glad to present Peter Muganga. He is from Reproductive Health of Uganda, and he participates in his organization participates in the first part of the pilot, and he will share with us his experience as an organization implementing the dashboard. Peter, the micro is yours.
Thank you, Lourdes. Good morning, good evening to you all. This is Peter from Reproductive Health Uganda, and I'm here to share the dashboard, the RHU experience. I must say that as a background, next please, next slide please. As a background, RHU is one of the leading sexual and reproductive health service organizations in Uganda. And in 2010, RHU got funding from USAID to implement a community-based HIV care and support project. And in 2012, through support from the LMG Project and MSH, the dashboard was introduced to the CBHA project. The initial focus of this dashboard was the PEPFAR indicators. Next slide, please. Next slide, please. Yeah, basically, what was the dashboard aimed at? What was the rationale? Why did we have to adopt this dashboard? We realized that the project we are running was a broad project with 3 result areas. It had HIV care support, it had OVC, it had capacity building as components. And we needed a tool that would ease our presentation to the stakeholders, bringing out the key performance areas with graphical presentations that can easily make them follow. Secondly, the dashboard, we saw it as something that was going to break the monotony in presenting results to stakeholders. We are primarily using the tables, the graphs, the normal way. But when the dashboard was introduced, we thought this would help us to have a powerful graphical presentation that would easily be understood by stakeholders from various fields. And as an institution, RHU needed a tool that could give a snapshot view of key performance indicators for the project initially, but also for the entire program in the long run. The other rationale was the multiple result areas that we needed to present to the various stakeholders. This was a community-based project. The stakeholders were varying from donor representatives, from governance representatives, from other stakeholders we were working with, partners and others. So we needed a tool that could make us be able to present the performance in a way that could be understood by people from different backgrounds. Next slide, please. What have we been able to achieve with the dashboard, the PEPFAR Management Dashboard? Through the implementation period of the project, the dashboard was used in all review and planning meetings. We had forums that brought on board stakeholders at different levels, governance, funders, the community, the beneficiaries themselves. So in these meetings, especially the quarterly review meetings, the annual review meetings, we presented our performance using the dashboard. And the aspect of depicting indicators and outputs in a graphical presentation helped us to explain and generate more discussions about our outputs. We realized that the stakeholders and even the process owners were able to appreciate better the need to compare indicators against targets at every moment of review, because it would bring out where we have strength and it would bring out where we need to put efforts on. Also, the graphical presentations, as I already said, helped both the staff running the project and those other stakeholders to identify areas of weakness and focus on those areas to create an improvement overall in the project and our performance. And lastly, also, the dashboard helps the project managers to focus specifically on areas of improvement through the action plan. The action plan component, because at every review, you're looking through the action plan. What were the areas that we needed to work on? Have we worked on? Do we need to change the priority intervention we thought would work? And that helps us to improve. Next slide, please. Of course, there were challenges in implementing this intervention. First, like I'd already said, the entry point of the dashboard in RH operation was through a project, the community-based HIV project. And as such, most of the focus initially was on that project. And when the project finally ended in 2014, a big resource of people who were part of the dashboard team had to leave, and continuity was challenging because a big part had left. Initially also we had issues with licensing the software. We were using trial versions, and with the trial versions we couldn't do much in terms of the formatting, working through the master sheet. We had challenges, and until the second year of implementation when we were able to get the licenses. And thirdly, the project had a lot of indicators to track. There were quite a number of them across the result areas. HIV had lots of indicators. OVC care had a lot of indicators. Deciding what goes into the dashboard initially was very challenging. Very, very challenging, because we understood the principle that the dashboard is not an M&E tool. It's not a database. So we had to go through a process on picking the key indicators that would bring out key performance areas. Next slide, please. How were we able to overcome those challenges and move on? We were able to select critical indicators among the many to be used in the dashboard. As I'd already highlighted, we had very many indicators across the result areas, but we were able to pick out those indicators that were critical to our attainment of performance objectives. And secondly, we worked as a team to generate the subsequent dashboards, periodic dashboards, and we had to put in place a dashboard team, which was charged with the responsibility of, first of all, tracking the data that comes in, periodically sitting to review that data before it's fed into the master sheet, and also generating the dashboard and generating internal discussions before sharing it out to stakeholders and other wide process owners. Lastly, we institutionalized the intervention to ensure continuity. We realized that this was a good tool, not only for the USAID-funded project, but for the entire organization-wide operations. So we made it as part of institutional process, and we drew in participation from other people who were known on the project. And this helped us to foster continuity after the completion of the project. Next slide, please. Here to share is just a snapshot of what the RHU dashboard looked like This very slide shows the dashboard from Lila branch. Lila is a site, one of the implementation sites, and it was depicting programmatic indicators against the target. And as you can see from the tabs, you could manipulate this to look at all the other branches. You could look at the partners. You could look at the aggregated, all when you use the tabs up in the slide. Next slide, please. This is also a slide showing the financial indicator, the financial component. And like the word dashboard, there is a whole bunch of information here, as you can see. A lot of information just summarized in this slide, which you can choose on what you really want. Do you want a summary like the one presented? If you want to get the overall, you could go to head office tab and you get. But here specifically, we are looking at expenditure against budget. We are looking at expenditure by partners. We are looking at expenditure against budget category. Next slide, please. Thank you very much. I think I will end here. Thank you.
Thank you so much, Peter. As we said before, if you have, for participants, if you have any questions, you can write it down. We will answer them at the end. And now I'm glad to introduce Dr. Doreen Agasha, Senior M&E Officer from Protecting Families Against HIV/AIDS. Please, Doreen, go ahead.
Thank you very much. Good afternoon, everyone. I would request that the slide. Thank you very much. So, Protecting Families Against HIV/AIDS is a national, it's a local NGO within Uganda, and our focus is on helping people that are living with HIV/AIDS not to pass it on to their children, that is mother-to-child transmission, and also keeping a family safe from HIV in general. We do a lot of work with district local government, making sure that they are able to provide PMTCT services along with other HIV-related services. So we partnered with LMG to come up with a PEPFAR Management Dashboard, and at that time our driving factor was we needed to see how our achievements are relating with the resources that we are using during implementation. The other thing is we wanted to be able to visualize our achievements more easily, so that the description is much easier. That's why we are talking about captivating way of displaying this information. Next slide, please. We got some challenges. The Ministry of Health required districts to use a system that they introduced just about the time that we had introduced the dashboard, the LMG dashboard, and that is the DHIS2. The DHIS2 is a national health management information system that we use during collection of any health management information from any of the facilities that we work with in the district. So the Ministry of Health required that each and every health facility reports using the DHIS. So the DHIS to have its own dashboard, which rendered the PEPFAR LMG dashboard almost irrelevant at the time. It was difficult for PREFA because working with the districts entailed rolling out the DHIS2 for all the districts, and This was after we had rolled out the PEPFAR LMG dashboard. However, in as much as the DHIS2 gained success at the district level, as a PREFA, we decided to maintain the LMG dashboard because the DHIS2 does not have financial components to it, whereas the LMG dashboard does. So we prefer to keep the LMG dashboard at head office and use it for performance review and other aspects of it that are useful. Along the way, we learned that to sustain its use and to keep it functional, we had to have clearly defined roles for all members of the M&E team. What happened was the team that was trained on the use of the LMG dashboard, some of them left the organization, and then also because we're rolling out the DHIS2 in all the districts, we kind of put the LMG dashboard on hold. This affected its sustainability and its functionality greatly. However, because we could not overlook its importance at head office, we decided to make sure that we revive it, and we are very grateful to the LMG team that came back to provide more support, especially to the new staff that had come on board. Next slide, please. So the dashboard facilitates a quick interpretation of data and enables sound decision making. It gives a visual description of project performance at district and NGO level. And that is what we've been able to do at PREFA. Especially on our performance, we have entered this data in every quarter for the 2015-2016 period. And as you can see, that's just a snapshot of one of the areas that we deal with. You can see how you have progressed across quarters based on the target and also actual performance. So it's been a very important tool for us. We have learned a lot. We have seen differences between quarters. We've been able to explain what is happening between quarters. We have two projects under this dashboard, the EMTTT project and the IRS project. And it wasn't easy setting this up. One of the previous presenters took us through what it looks like and how to set it up. It wasn't easy, but we are very happy that we got a lot of technical support. We actually want to include one of our, the third project that we have, so that we can have all three projects on the dashboard and we monitor them and study them using the dashboard. Next slide, please. So our way forward is institutionalizing this dashboard at every level in our organization. Like I said, right now everyone knows their task and they try their best to do it. Because if any of them doesn't do their bit, then it becomes very difficult to actually have information in the dashboard, and then for a program meeting to be informed and then decisions to be made with a lot of understanding, background understanding. So we want to institutionalize it as much as possible. We want to upload the financial information that we have in order to enable tracking output. So that is one of our plans, and our target is by June 2017, we should have a fully functional dashboard. Thank you very much.
Thank you so much, Doreen. And thank you for some of the presenters, the participants that are already writing their questions in the QA box. You can continue doing so, and after Peter's last presentation, we will continue with the Q&A. So I'm glad to introduce Peter Njonga from National Organization of Peer Educators. He is going to present his experience implementing the dashboard. Peter, go ahead.
Thank you. Again, it's good to repeat my name, Peter Njuguna. I work for National Organization of Peer Educators. I'm the M&E guy. and the experience with the company, which I would be happy to share. And why did we adopt the PEPFAR dashboards? Number one is that NOPE, from its background, has had a desire to include technology as part of the way we implement our programs. And therefore, we were looking for a simpler way to put all what we do into a simple context, which dashboard answered this question. The thing we needed was that we wanted a board, and it's good I mentioned that our board before was just an oversight board, and it had just come in as an advisory board with some roles in actual implementation of projects. We wanted them to come to quick pace and catch up with us and understand what is it that we are doing so that they could provide a role to the projects. The next thing is that we wanted a simple picture for our stakeholders, both internally and externally. We wanted our donors to see what is it that we are doing. We wanted our people that we reach, the girls, the youth, the workplaces, the boys, all the people, the government we're working with, the staff, we want everyone to understand NOPE from data perspective, but simplified so that it's not scary enough. Next slide. And as we are going on, it became apparent that we were to face some challenges. And some of these challenges included arrangement indicators that were not similar to the institution. You know, projects check up specific indicators that they want you to report. For example, if we have an indicator, number of key indicators we have reached, but the projects might not specifically. So sometimes we would find that we are having challenges to define one indicator. And of course, there are ways we went around it, but of course, there were some places that we had to generalize. The next was to understand and accept dashboards as a way of working and as another way of reporting the work we were doing, and to request this data from specific people who are in charge of giving us the data from the field so that we could consolidate it and put it in the database. Took some time. And of course, as my colleagues have said, that there was a tree short in the south, and therefore we had a lot of challenges trying to bring to pace people who are just. The next was to unify NOPE indicators into 10 solid indicators. And I want to diverse from HIV work to workplace programs to even governance issues, and to bring to solidify 10 indicators was quite some task, and sometimes we realize that we are not fully addressing all the indicators. The other one was about quarterly or periodic reporting that we have, and sometimes projects do not feel like quarterly or annual reporting. I'll give you a good example. Like now in the Coast Province, we're doing a project that is building the capacity of CSOs. And to measure and build capacity, we need to follow this cost that is measured longitudinally over every month. And therefore, it became sometimes difficult as we are reporting on the other side to put this into the database and to include it as part of what we reported in the dashboards. And then, of course, the usual challenges of projects, that sometimes we would have challenges of distance and collecting data on time to have people in the field to understand that this is a production of a dashboard, which we time to the board meeting so that we could present it just the first week of after every end of the quarter of the board. Term dashboards. But it was very difficult to convince people how dashboards related to their careers. Some people thought that dashboard would be some software that you learn and now that you can include it in your CV. So the quick question was, where do I include dashboards? Now that you have inducted me in these, where do I include it in my CV? What do I write on my CV? And therefore, trying to explain that you understand that yes, you can use dashboard, but dashboard is just a way of presenting data. Lastly, on our challenges, we wanted to provide to advocate use of dashboards to other organizations. And usually you realize that some organizations are using other methods of displaying their data. Like, for example, a partner organization where they are wondering, what is this software you want me to adopt and learn so hard? I don't want this. So I think, in my opinion, that it is good as we continue to discuss about dashboards, to have a pitch that convinces people of how convicted I am right now about use of dashboards. Next slide, please. Great. Despite the board's conviction that dashboard is the best way to present data. I don't remember, definitely, the last time we met, they were quite excited. They see me, they say, wow, I like you and your dashboards. The other thing is that it has become a habit that our board meetings include that, and therefore that's a great milestone. The advisory board is looking at our data and giving opinion, and which now comes back as ways of us taking some go to a website. I've tried to put up dashboards as viewable on our website, and we had a few challenges there, but I'm definite by the end of the year we should have our dashboard presentable and visible on our homepage, and as part of our online newsletter, which will be going out there. Next slide.
Thank you so much, Peter. Now, thanks everybody for the questions that are already written in the box, in the Q&A box. If you have more questions, please go ahead. And we will start with the first one. That is someone, Andrea Christie, is asking if this program of this dashboard can be used in a healthcare hospital setting. Danilo, do you want to answer that question?
Absolutely. Thanks, Lourdes, and thanks to Andrea. I think the answer would be yes, but as long as the organization or the setting complies with the minimum requirements from the technological standpoint, but also from the organizational standpoint. One important thing that I think is that from the organizational standpoint is that if information it's already analyzed in the form of indicators, then I don't see a problem with using it. But the caution the caveat there is that this is not in the case of a healthcare hospital setting, this obviously would not replace the current administrative patient management systems that the hospital has. This is not an epidemiological hospital discharge follow-up system, for example. But if the information can be expressed in terms of indicators and interventions, I don't see a problem with using it.
I'm glad, Danilo, you say that, because the second part of Andrea's question is it seems to be only designed for financial data. Can it be adopted for non-financial data, such as patient data? You already answered part of this, that is not patient data, but you can have programmatic indicators. Maybe you can explain a little bit more?
Yeah, as I say, for example, maybe you're not going to go into clinical details of the of patient, for example, but if this can be expressed as, let's say, the percentage of discharges for a particular disease which are linked to an intervention, for example, or other indicator like hospital or like length of stays or other indicators that are more programmatic, then this could be easily shown on the dashboard.
Thank you very much. We have other questions from Pascalia Mungi Wendy, and this is she is asking if the PEPFAR Management Dashboard can be replicated to be used by health facility managers in clinics or community health centers. I don't know, Peter Muganga, do you want to answer that? Do you use the dashboard just for the headquarters, or it was used for facilities as well?
Yes, I can answer this, I think. The dashboard can actually be used in most situations related to healthcare service provision. What is important is, do you have indicators that you can track, and do you have targets for those indicators? So long as you have those, then the dashboard can be applied to such institutions as well.
Thank you so much, Peter. We have another another question from the same person. That what are the socio-demographic characteristics of the managers who use the PEPFAR Management Dashboard? It is necessary to have to give them previous training. I don't know if Anisha, do you want to answer that? Or Danilo, do you want to answer that?
Yes, sure. I think more than from a social demographic perspective, which would only, for example, relate to Asian sex or other characteristics, I think it's more, this should be analyzed from the skill set and also the level of involvement within the organization. For example, for me, a manager should at least have some sort of data analysis skills, but also the level within the organization, the level of authority, enough level of authority to actually, based on dashboard information, be able to make this informed decisions. I think those would be the most important characteristics for me in case of a manager. There are obviously other levels within the hierarchy of the organization, which would need more in-depth technical capacities to be able to produce the required information that's going to be used by top management.
Yeah, thank you so much.
Yes, and to,
yes, please.
Yes, and to add on, apart from the social demographics of the managers, is also that you realize in workplaces people have different skill sets and different attitudes. They need to just induct them into how do they look like, just to remove that paranoia from software. But I don't think you need to do a lot of training, because most of the people in the offices have average skill sets to use Excel, PDFs, and such.
Thank you so much, Peter. We have a comment from Emmanuel Ware that says that he wants to add to the principles of the dashboard that Danilo highlighted, that it is important to note that the dashboard is not an MIS database, nor does it replace your financial management system, if it only facilitates data utilization. But also I have another question for Danilo about that. Is from Sam Smatter. He says that Danilo mentioned that involving users in the design, but can you please, Danilo, speak a little bit about the process of rollout and change management for the decision makers? How to adjust management decision-making procedures, adoption of the new tool? Sure.
I think this is a key question in the rollout of a tool such as the dashboard, because it is related to a whole organizational culture change process from my perspective, because sometimes we could be faced with organizations that are used to doing it in some certain way for a very long time. So it takes quite a while for, in this case, people, the person rolling out or promoting the use of the dashboard to actually change that mindset. But I would like to mention some ideas that are linked to actually changing the mindset. Because first is that generally organizations are handling, I think, more information that it could be not as strategic as they think. Information per se, I mean, to have a huge set of information per se does not guarantee that we have the key situations under control. So that's the first point, I think, in favor of actually using the dashboard to analyze key strategic indicators. Also, that as being a part of a management improvement process, the dashboard, the use of dashboard per se, is also a capacity development tool for the whole team that is involved in developing the dashboard. Because in being involved in this process of this technological processing at start, I mean, from installing these files and generating these files, to being involved also in the analysis process. People who probably before were not involved in this whole data analysis procedure can gain important capacities, not only for their careers but also for their organization. And finally, I think consulting with the actual users will allow all the organizations to be more strategic. For example, together using the dashboard and analyzing it, they can decide what are the main audiences that are going to receive the messages, what type of message do they want to communicate. They will also have an important tool in the action plan. They're going to have an important tool for presenting donors with roadmaps to fill or close gaps. So I think those all are the points in favor of actually developing the dashboard. But obviously, and we cannot deny that, this will take some change in actually changing the organizational culture.
Thank you, Danilo. I don't know if any of the other panelists could to add something about the process, how to engage your stakeholders in the decision-making process. Yeah? No, Peter or Doreen?
Can you hear me?
Yes, thank you, Doreen. Go ahead. Yes, go ahead, Doreen.
Yeah.
Add one more point.
Let's allow Doreen to, and then the others can talk.
I wanted to say that involving stakeholders can be quite challenging if they don't appreciate the purpose and if they don't, if it's not consistently used. You can make a presentation at the end of Q1 and everyone is excited because they love to see that dial, they love to see things visually represented. And it's like somebody already said, it's important to have the key indicators that actually speak to your program displayed clearly, and then one can look into the details later and sort out wherever the problem may be. And if something is doing well, then it's okay. But then if you don't consistently present this information, for example, to the board or to the managers or to a program meeting, people kind of forget it because it's not a reporting tool. The chances that someone will pay more attention to a report are higher than paying attention to a management dashboard. So there must be someone that takes charge of it. There must be someone that makes sure it is presented. And then there must be people that make sure they upload information on those specific indicators into the dashboard. So once the culture is developed, then it becomes easy. If someone knows, I don't have to carry anything else to this meeting, I will be looking at the dashboard, I will interpret the dashboard, I'll ask my questions around the dashboard, then it is entrenched in the culture of the organization. But if it's going to be once in a while the M&E team shares the dashboard, then it becomes difficult for stakeholders to actually embrace it and find it useful for them.
Thank you, Doreen. Peter, do you want to add something? Peter Nujunja? No? Okay, so we have another question, also from Sam Smather. He said, and it is probably for Danilo, that the SAP software seems to be a critical tool for the proper visualization. And one of the presenters mentioned problems with cost, access. Are there open source or other solutions for low source setting where it's not possible to procure SAP?
Okay, thank you, Lourdes, and thanks to Sam for the question. Yes, SAP being developed by this German company, as we have been informed by our tools specialists. The SAP license needs to be procured by the organization, but it's offered at a discount for them. And it's very powerful, and it generates this marvelous dashboard. Thinking of the open source part of the question, I could only think that in settings that where it is impossible to install or procure stuff, the only answer probably there would be to use the power of Excel to actually produce graphs. Excel itself can produce also dynamic dashboards using customized pivot tables, and it can also provide dynamic graphs. That will be, I think, a very kind of worst case scenario.
Thank you very much. We know that there are discounts for NGOs to buy the program. So you can go into the page, and we are going to send you the details, but you can go into SAP website, and there is a special discounts for NGOs. Also, we have another question, and I think these questions could be answered by Peter. The question is, if there are standards indicators in the dashboard, or how the indicators are selected. And Peter Muganga, do you want to answer that? You already did in the box, but I want everybody to listen to your answer.
Yeah, answering that specific question, the indicators are non-standard. They really depend on the program you're implementing. So they change as per the program, as per the activities you're focusing on and what you really want to track. So they vary from institution to institution, project to project, depending on how you want to track what you're doing. Thank you.
Thank you very much. I also want to talk, to put Emmanuel Ware has a comment that he said that the dashboard helped us visualize the operating performance of our individual branches, to compare performance across branches, and use the results information to guide performance improvement. Thank you, Manuel. And we have another comment from Fred from Ghana, from Ghana Health Service. He says that the Ghana Health Services uses the DHIS2 and built dashboard. Regardless, there is no legal commitment to the use of data for decision making. What will be the way to go about the commitment problem? Who wants to answer that question? Maybe, Doreen, do you want to talk about that?
Yeah, I can answer the
Thank you.
The DHIS2, it's a good thing to know that they're using it in Ghana as well. It has its own dashboard, and however, it captures specifically indicators that are are according to the national record system. So it may not be that they may not exactly answer to an organization's strategy or specific indicators. So it's the same idea. It's a similar idea. Actually, it's not the same. It's a similar idea. You get to see how the districts are performing. As long as you enter the information right, you can see the graphs and everything. But in terms of targets and plans and strategic direction for a specific organization, it becomes very difficult to mingle that with the national health management information system. So like somebody said, you need to tease out what exactly do you want to track? What exactly are you interested in? And if you can track it on the DHIS2, fine. But it may not be that easy. And then you can't put in financial information in the DHIS2. Well, for Uganda right now, it is still a lot of health management information only. So if an organization wants to see how they are doing on that front as well, then you may need to look into another dashboard.
Yeah, thank you so much, Doreen. I also want to mention that this management dashboard, at the back of each graphic, this is a room to place comments. So it helps. It is not just to present the data. It's to present the data and then discuss with the stakeholders what the data means, what could be the root causes of that indicator, and then put comments below each of the graphic. What is the meaning, the explanation? Because these comments are the ones who are going to appear in the last tab when you develop the action plan. So if we find out, for instance, that we are not expending the money, then in the comment graphic maybe appear, we are not spending the money because the financial or whatever tax didn't allow us for these regulations, etc. Then this comment allows you to go directly to what could be the solution of that. And that is the action that is going to be written in the action plan. So this is the last tab of the dashboard is critical. When you are writing comments below each graphic, and this at the end you can have these comments, and from the comments you can go to decide what actions needs to be made. So that is what can help the decision making and the commitment, who is going to do what at the end. Thank you very much. We have just one more question because we are running out of time. Is the dashboard use and applicable for all health programs, or it is just specific for PEPFAR funded programs? Danilo, do you want to answer that?
Sure. In this case, it will be applicable for all programs, not specifically PEPFAR, but as long as I had mentioned, the data can be conveyed in form of indicators and can be separated by interventions.
Thank you very much. And then the other questions are related to the availability of resources that people can use, where to go to find our materials, if this conversation or this presentation is recorded, if the slides are available, or if we have a dashboard guide that they can use. So I would like to pass the macro to Greg to see how resources can be found.
Hi all. So all of these resources are currently available on the Leadership Management and Governance Project's website. The URL for the website is www.lmg4health, 4 is spelled out, as well as health.org. I've also been sharing some hyperlinks in the chat box during the webinar. and we'll follow up with everyone afterwards as well with the link to the tools as well.
Thank you very much. Thank you very much, Greg. So I don't know if you, Danilo, want to add something?
Yeah, just in the part of the visualization, that it's very important for people who are going to be the audience of the dashboard to use Adobe Flash Player. Otherwise, they would not be able to see the dynamic content of the dashboard. So that's a very important piece of software to have.
Okay, so thank you very much for everybody for attending. So you can find the resources in the place that Greg told us. And if you have any comments or questions, also in the page there is a place to send messages or by email, and we will more than eager to answer every further question you may have. Thank you very much and have a good day or good evening wherever you are.